If you or someone close to you is experiencing feelings of sadness, excessive fatigue, or sleep disturbances, it's natural to consider depression as the cause. However, experts emphasize that various conditions can imitate the symptoms of depression, leading to potential misdiagnoses by doctors. According to an article in Current Psychiatry, approximately 26 to 45% of individuals referred for depression don't actually meet the established diagnostic criteria for the disorder. A comprehensive analysis of 118 studies revealed that general practitioners accurately identified depression in only 47% of cases, and they sometimes diagnosed it in individuals who did not have the condition. The difficulty for healthcare professionals lies in the absence of a singular, definitive test for depression, as highlighted by psychiatrist Jonathan E. Alpert, MD, who serves as the chair of the Council on Research at the American Psychiatric Association. "We cannot rely on blood tests or MRIs to diagnose depression," emphasizes Alpert, who serves as the chair of psychiatry and behavioral sciences at Montefiore Medical Center and the Albert Einstein College of Medicine. Instead, established guidelines require patients to exhibit at least 5 out of 9 specific symptoms refer to the box for a duration exceeding 2 weeks. Additionally, healthcare providers must eliminate other potential conditions, according to Alpert. In the case of older adults, experts stress the importance of considering alternative diagnoses. While depression can affect individuals over 50, it is more commonly experienced in early life. Furthermore, older adults may present atypical symptoms or have other underlying conditions that either cause depression or mimic its symptoms. Diagnosing depression proves challenging due to symptom overlap with chronic medical conditions, early-stage dementia, sensory impairments, and medication side effects, notes Meredith Gillum, MD, a geriatrician and medical director at the University of North Carolina Geriatrics Clinic in Chapel Hill. Resolving the true nature of the situation requires time and patience from both family members and clinicians. The significant risk of misdiagnosis lies in the potential neglect of a severe condition, such as cancer or dementia, that could benefit from early intervention. We will see now some of the prevalent conditions that can imitate or contribute to depressive symptoms. Thyroid dysfunction. Thyroid disorders are frequently misinterpreted as depression, warns Joseph Lai, a general practitioner at Novant Health in Charlotte, North Carolina. The thyroid, a butterfly-shaped gland responsible for regulating vital bodily functions such as heart rate and energy levels, becomes more susceptible to issues with age. Joseph Lai emphasizes the widespread influence of the thyroid, stating, "If not working properly, it can definitely mimic depression. Symptoms like fatigue, feelings of sadness, and irritability, which align with depression, can also manifest due to thyroid problems." However, distinguishing factors include indicators such as weight gain, swelling, cold intolerance, and extreme fatigue, which may suggest an underactive thyroid rather than depression, as noted by Alpert. While depression may manifest as a lack of motivation or interest, an underactive thyroid can make individuals feel depleted of energy. Furthermore, an overactive parathyroid gland, a distinct thyroid disorder resulting in elevated blood calcium levels, can produce symptoms resembling depression. Approximately 20 million Americans suffer from some form of thyroid disease, with up to 60% unaware of their condition, reports the American Thyroid Association. If there is suspicion of a thyroid problem, seeking a healthcare professional for testing is advisable. Diabetes. Diabetes, affecting around 38 million individuals in the United States, with approximately 25% of adults over 65 being affected, presents a noteworthy concern. Strikingly, the Centers for Disease Control and Prevention (CDC) reports that 1 in 5 people with diabetes are unaware of their condition. The symptoms of diabetes, including fatigue, irritability, and unexplained weight loss, can overlap with those of depression. To discern whether diabetes might be the cause, psychiatrist Alpert suggests paying attention to additional indicators such as excessive thirst or hunger, along with frequent urination, which are classic signs of diabetes. A straightforward blood glucose test can confirm the presence of the disease. Vitamin deficiency. On occasion, symptoms resembling depression can stem from a deficiency in essential nutrients. 2 commonly deficient vitamins in many older adults are vitamin D and vitamin B12. According to the Cleveland Clinic, around 35% of US adults lack sufficient vitamin D. Symptoms of this deficiency, such as a lack of energy, pain, and weakness, can mimic those of depression, as noted by Joseph Lai. An accessible way to increase vitamin D levels is to spend time outdoors, as sunlight facilitates the conversion of sunlight into vitamin D. Vitamin B12 is crucial for nerve function, and a shortage is linked to conditions like depression, dementia, and reduced cognitive function. Given that older adults are more susceptible to vitamin deficiencies, Joseph Lai emphasizes the importance of checking nutrient levels before concluding a depression diagnosis. In the case of a deficiency, healthcare providers may recommend supplements to address the shortfall. Cancer. Numerous symptoms commonly associated with depression, such as a decrease in appetite, weight loss, and fatigue, can also serve as early indicators of cancer, according to insights from Alpert. Moreover, recent research suggests that depression may precede the formal diagnosis of cancer, prompting researchers to view it as a potential early warning sign of an underlying disease process. In a notable 2016 Swedish study involving 300,000 cancer patients and over 3 million cancer-free individuals, researchers observed a higher likelihood of psychiatric disorders being diagnosed in the 10 months leading up to the cancer diagnosis compared to those without cancer. This finding highlights the intriguing connection between depression and cancer, suggesting that psychological symptoms may manifest before the onset of overt medical symptoms. The correlation between depression and cancer is particularly pronounced in the case of pancreatic cancer, notes Alpert. 2 review studies indicate that between 33% and 45% of individuals with pancreatic cancer reported experiencing psychiatric symptoms before the manifestation of their medical symptoms. Indicators of depression. If you are experiencing any of the following signs associated with depression, it is advisable to consult with your doctor. Persistent feelings of sadness or a consistently depressed mood. Diminished interest or pleasure in activities that were previously enjoyed. Unexplained changes in appetite, leading to either weight loss or gain unrelated to intentional dieting. Disturbances in sleep patterns, such as difficulty sleeping or excessive sleep. Fatigue or a noticeable increase in feelings of exhaustion. Engagement in purposeless physical activity, like restlessness, pacing, or hand-wringing, or conversely, a significant reduction in movements or speech noticeable to others. Experiencing feelings of worthlessness or guilt. Challenges with concentration, decision-making, or clear thinking. Persistent thoughts of death or contemplation of suicide. If you're looking for an inspired read that goes beyond the pages, the Anti-Anxiety Formula is the ideal choice. Immerse yourself in this transformative guide and discover paths to a calmer mind and a more meaningful life. Dementia. The initial indications of dementia often involve a sense of detachment and a waning interest in activities, characteristics that can closely resemble depression. Meredith Gilliam points out instances where individuals were initially thought to be dealing with depression because they withdrew from social activities like dinners with friends, became more reserved in group conversations, or lost interest in activities requiring concentration, such as watching movies. However, as time progressed, it became evident that dementia was the underlying cause, particularly as memory and cognitive processing challenges became more pronounced. Experts highlight that the key distinguishing factor between the two conditions lies in the memory deficits associated with dementia. Unlike individuals with depression, those with dementia commonly experience forgetfulness and may even become disoriented or lost in familiar surroundings. Parkinson's disease. Parkinson's disease triggers chemical alterations in the brain, particularly the loss of dopamine neurons, resulting in diminished motivation, engagement, and interest. According to insights from Alpert, these effects often closely mirror the symptoms observed in depression. In some cases, individuals with Parkinson's may exhibit signs of depression and apathy even before the emergence of motor symptoms, such as stiffness and tremors. Diagnosing Parkinson's typically involves a neurological examination, where healthcare providers assess for indicators like tremors, stiffness, rigidity, slowed movement, balance issues, and a reduction in facial expression. It's noteworthy that individuals diagnosed with Parkinson's face a heightened risk of depression. Studies indicate that up to half of Parkinson's patients will encounter some form of depressive symptoms during the course of the disease. Anemia. Anemia occurs when there is an insufficient quantity of healthy red blood cells to adequately transport oxygen to the body's tissues. The resulting fatigue, weakness, and difficulties in concentration are symptoms shared with depression. The likelihood of developing anemia rises with age, particularly in individuals over 65, as indicated by the Centers for Disease Control and Prevention (CDC). While iron deficiency stands out as the primary cause of anemia, other factors such as intestinal bleeding, malignancies, or deficiencies in folic acid or B12 can also contribute. Apart from weakness and fatigue, anemia may manifest with additional symptoms like cold hands and feet, dizziness, and shortness of breath, indicators not typically associated with depression. A straightforward blood test can be employed to diagnose anemia. Medication side effects. Feelings of sadness, depression, and even suicidal thoughts have been linked to over 200 different medications. A study published in the journal JAMA revealed that approximately 1/3 of Americans are currently using prescription medications that have the potential to induce depression or heighten the risk of suicide. Common culprits among these medications include steroids, sleep aids or anti-anxiety medications, anti-seizure drugs, and opioid pain medications. Psychiatrist Alpert notes that when individuals exhibit symptoms of depression, healthcare providers often consider whether these coincide with the initiation of a new medication. It's crucial to recognize that side effects such as depression may not surface until weeks or months after starting a new medication. If there is suspicion that a medication is contributing to low mood, it's important not to discontinue the medication independently. Alpert advises discussing concerns with a healthcare provider. Depending on the importance of the medication for the underlying condition, the healthcare provider may choose to continue the medication while addressing depression through the use of an antidepressant. Persistent grief. Experiencing grief is a natural response to the loss of a loved one. However, if your grief remains intensely disruptive to your daily life for more than a year following the loss, what might seem like depression could actually be classified as prolonged grief disorder. Prolonged grief disorder is a recently recognized psychiatric diagnosis marked by enduring yearning for the deceased and challenges in accepting the reality of the loss. Despite the similarities in appearance to depression, psychiatrist Alpert notes that there are distinct, evidence-based psychotherapies designed to address prolonged grief, offering targeted support and the potential to restore a sense of normalcy. And for those of you who have come this far, subscribe to the channel to learn more about mental health and personal development with me. See you in the next video.